Hello, this is Sally Kapai. I'm here reporting from Ukhrul district, Manipur. As we all know that the world has been shattered and shaken by the outbreak of the coronavirus pandemic. So we're here to find out, are the district administration ready, or are they really prepared when the stranded citizens are coming back from the metro cities once this lockdown is lifted? Are the medical department, the district hospitals, really equipped when there is a spread of this coronavirus in this district? What about the CSO's leaders? Are they really able to reach out to the citizens stranded in the metro cities? Are they able to mobilize? We're here to find out. I'm here right now standing at the district administration, that's a deputy commissioner's office. We're going to interact with the officials, including the deputy commissioners and the CSO's leaders. So once this lockdown is lifted, a lot of stranded citizens will be coming back. So as a district, are we prepared to welcome them?
Yeah, definitely. In fact, 2 weeks before, we have started collecting data of our people, especially students stranded in different parts of the district. In this, the CSOs were helpful, especially the Tangkhul, Katama, Saplong, under the aegis of TNL. They have collected data from each village, and they could collect data of around 15,000 people. And out of which, following the instruction from the Home Department, we have issued a notification to those people who are willing to come back after May 3, when lockdown is likely to be relaxed. And so far, we received around 3,600 willing people who want to come back to the district. And for this, in consultation with the Honorable MLAs of Ukhrul and Chingai, we have set up quarantine or community centers, out of which Pettigrew College is one of the prominent center which we have earmarked, because this center is slightly away from the main habitation, from the main town, and they have classrooms which are not occupied now, and they have this multi-purpose hall also which can accommodate. Then we have also already placed some beds at Ukhrul town. This one, the town hall. Ukhrul town hall. We have already placed some beds. Then Phungraitan community hall. Then we have identified Old District Hospital, Kamphasom community hall, Awantang community hall, Model High School, Baksi ground hall, and Ukhrul Higher Secondary, Youth Hostel, Phungraitan. So these are the quarantine or community centers. And for Chingai Assembly constituency also, we have the Sondal Higher Secondary School, Jesami Higher Secondary School, plus JNB there. Then we have Toloi Higher Secondary School, and this and there's other schools, private schools also there. So these schools are slightly a better place for community quarantine center, because they are slightly away from the middle of the village also, and they have large space, and since classrooms are not being occupied now. So we have identified this with the help of our honorable MLAs, the SDOs and the CSOs who have contacted the villages.
How many quarantines in total have we identified?
We have already completed the home quarantine of 269 people, and as of now 5 persons are under home quarantine. That is the family of CO 27AR. They had come back from Assam, so they are under home quarantine, and they will be completing their home quarantine today. That is they are completing 14 days today. So we will be able to accommodate now some 3,000 to 4,000 people in this district headquarters, and the other population will be able to cooperate within the Chingai Assembly constituency.
Those quarantine which has been identified, are they well equipped, or it's still in the process?
We have inspected along with CMO and all, and these institutions, like since they are presently being run, they have some running toilets, washrooms. But if more people are accommodated, we will construct temporary toilets also more from this Swasth Bharat Mission Fund, that is with the PhD.
Tangkhul's website is one of the way to reach out those stranded people, right?
Right.
But apart from that, do we have any such facility that reach out to our people?
As of now, the Tangkhul MLAs, they have set up the corpus fund of 10 lakh each. So 30 lakhs they have set up corporate funds, and they have opened a bank account, and they are already reaching out to our people standard outside. And I think they have started availing help from this. Besides that, there is no individual appeal as of now to the district administration to help individually. But it is good that our leaders are looking after them. The MDC members are also in touch with people from their various constituencies who are standard outside. The village authorities and their families are in touch with them. So as of now, luckily, fortunately, district administration, we are not facing appeal from the individuals who are standard outside.
Okay. So in case if the rail network and the airline is not lifted, what are the other alternate options to bring them back?
The state is working out. State government is in the first phase. They are bringing 84 persons from Guwahati, for which 4 buses have been sent. Out of that, there is no one from Ukhrul district. I think one is there from Kamjong district. So state government will work out phase-wise. But for states who are located far away, like in South India or in western part of India, it may take some time for the state government to work out, because the logistic calculation will be quite heavy. Many buses have to be arranged to bring them in.
Are the hospitals equipped to handle the cases?
Hospitals, they have been identified as isolation centers. So the district hospital, we already have personal protective equipments also, and they are ready to treat any person having symptoms with COVID-19. Then we have community health center at Somdal. Then all these PSC Talui, PSC Tainem, PSC Lambui, PSC Kangkhui, PSC Chingai, PSC Jesami, then Laisifung Christian Hospital, then CHSRC, that is Dr. Nelson's Hospital. They are all identified as isolation facilities, and they are having testing equipments. And especially the district hospital, Ukhrul, is now ready.
This stranded people, once they are like back at home, there will be a huge exodus, right? And I'm sure a lot of people who are coming back are also, like some are students, but majority, if I'm not wrong, are like working people. So all of a sudden they would be losing their job. So what kind of measures the district administration is trying to put that issue?
Actually, ideally though we cannot prevent our people from coming back to the district and joining with their families, but for those who can afford to stay back in their respective places, it is our advice that they should remain, because if airlines are not open immediately, traveling is a great difficulty, and state government also will find it difficult to arrange to transport each and everyone from every corner of the country. As of now, I think not all of our people who are outside are indicating to come back. So far, as I have already mentioned, so far we have received some 3,600 people who have indicated their willingness to come back. When they come back, of course, the standard protocol of the state for COVID-19 have to be followed. They will be screened, they will be tested, and at the testing centers at the state, and the mandatory quarantine of 14 days for those coming from hotspot red zone have to be followed. And after testing, and if the authorities are satisfied that they don't have any symptom, then they may be sent for home quarantine. So even if they go back home or to their village, they have to spend 14 days home quarantine. And it is our earnest appeal that those who can afford to stay back at their respective places as of now, it is better that they stay back and then continue with the works.
So what are the biggest challenges faced by the administration when we actually have this kind of measures taken up?
The challenges, as of now, I'm happy that our people are conscious and the villagers are having their own villages quarantine. They are preventing people from coming inside the village, and also their own villages coming out of the village boundary. And the CSOs are active, and the police force, they are maintaining strict social distancing and telling people to wear face masks when they come out to the public and all. So as of now, we are not having any major problem. It's manageable so far because of the cooperation and the sensibility of our own people against this pandemic disease. Well, it is my appeal as the administrator of the district that we should continue to fight this disease. We should take up a moral challenge, and as of now, the best means to prevent this disease seems to be social distancing, having personal hygiene, of wearing face masks and washing our hands frequently, or using hand sanitizer. And then whether we are at home or in the workplace or in office, we should continue to maintain this standard protocol prescribed by the government. And I'm sure with this consciousness and sensibility, we'll be able to come out successful against this COVID-19 disease.
So how prepared is Ukhrul district in handling the emergency in case of any eventualities? Are we equipped enough?
This is a question which should be raised actually to state health authorities. Across the country, districts are mandated only for isolation or detecting any suspects. For treatment or for actual testing, there are very few centers. For example, Nagaland does not even have a single center in the whole state. For their testing, it has to be done either in Imphal or they have to take it to Assam. So likewise, expecting something that is beyond the capacity of the district administration is also not a very wise suggestion that anybody can make. But with regard to quarantining, with regard to essential items, with regard to the district hospital, in context to ensuring that if there is a suspect or if there is an actual case of COVID-19, I think the district is prepared enough, and the medical practitioners, the experts, they have been trained, equipped well enough to handle any crisis for the moment, but not for treatment, this I tell you.
Okay. The MLA Corpus Fund was announced in March, but I'm told that the people haven't received anything yet, any assistance yet. So what is the status of the fund, and who is in charge, and how will it reach the right people?
MLA Corpus, well, it's not in March. This was initiated somewhere around the first week of April. And it is the 3 MLAs of the district who have initiated this. The thing here is the modalities of working out who deserves what amount. This is what is most important. We do not want this to come down to some sort of a scholarship sort of thing where everybody gets, 500 rupees or 1,000 rupees each. The most important part is the activation of this corpus fund. It is meant to actually help our people who are stranded outside, who are in actual dire need. This is not across the board like so many other state governments are extending help. One size for all means 1,000 means or 2,000 means, 3,000 means for everybody the same amount. Now, you cannot expect somebody with an ailment who is going to need 10,000 rupees to be given 1,000 rupees and say that he's been taken care of. Now, essential items and essential needs are being provided by many, many voluntary organizations across the country. So, our actual target was not for essential items. It was actually to see that anybody who is in dire need, whatever be the circumstance, to be able to provide that. Now, in the process of formation of a governing body and the management committee. It has taken some time, but the thing here is we just want to remind our community outside or wherever in the world that this pandemic is here to stay for quite a long time. So within the first month, you cannot start having multiple problems. That is why, if you remember my first interview, my first press statement that I had given, I had requested the community saying that this is something that the community has to come together and help each other across the world. The community has to step in. If the community does not step in, then this MLA Corpus Fund is nothing, it is worthless, because it is just a drop in the ocean. But what we were trying to show the rest of our people was that it is only through contribution amongst ourselves that we will be able to come out stronger than what we were before. So I think with regard to the implementation process, now with all the CSOs on board, and I think we have the church, be it the Catholic, be it the SDA, be it the Baptist, everybody's on board, and then this coming week, latest by Wednesday, I think they're going to start dispersing the funds, and as we go along, I think more and more funds are coming in. So I think that the most deserving will get their due share in the days to come.
You are a member of COVID State Consultative Committee, right? One of the members?
Yes, yes.
So what are the long-term plans the committee has taken so far?
Our first meeting, what was discussed is that we need to identify core areas as to how we are going to quarantine and isolate our citizens that are coming back from the rest of the country, how the mode of transportation as to how we are going to bring them back. And the first priority was the stranded. I think we have gotten in the first batch from Guwahati, who in the Guwahati Bhavan. The next step is to get in residents from the other parts of the Northeast. It was discussed in the meeting, and then I think the first step we will be bringing in whoever our citizens are and wherever they may be across the Northeast, that we will be bringing in. But with regard to the remaining parts of the state of the country, as the standard operating procedure is already out by the Ministry of Home Affairs, rail has been allowed only, that is, if the state government's requisition, and that this is why the inventory of all the people that will be coming in is being collated. Once the data is available with the state monitoring team, then we will know exactly how many trains we will require for which areas and how to go about this. That was the main core focus, one. Second was the lack of equipment across the state, if there be any. And I think that issue has also been addressed, because we had a lot of technical experts, medical practitioners that were there in the consultative committee, and with all the insights that they have provided, I think Manipur is way ahead of many more states, at least with regard to the Northeast.
Are they supposed to pay, with ticket money, or how does it work?
Let us take it from this perspective. There is a lockdown. Assuming that before the lockdown, or the first lockdown, it was to end on the 4th. When was it to end? I think some 21 days.
Yeah.
14, 15, it was 14 it was to end, and 15 it was open up. So many of our people across the country, they bought airline tickets. If we are allowed to come back, we are ready to purchase our own tickets and come back. But when the government is organizing, it is just the government, what the government is doing is, it is facilitating. It is not mandatory on the part of the government to actually pay the fares of our residents coming back, because they are our residents, they are our citizens, our brothers, our sisters, our children. The duty of the government here, I would like to emphasize on this, and I would like to, ask the community that it would only be fair that we as citizens fulfill our duties, and then paying the fare, it would not be so wrong, I feel, because the Guwahati part, the vehicles went, I think, empty while going, and on the way back, since it is only half the seating capacity, that also you cannot, fill the whole bus. It is only half the seating capacity, so the fare charges also, I think, went a little higher because of trying to ensure the costs for the operation be, fulfilled. Now with regard to anybody else that is wishing to come back home, which the state government is making arrangements for, from my side I would feel that it is only but mandatory and only the duty of a citizen to say that I will pay my due share, because a fare from Delhi to, let us assume Delhi to Imphal, to Dimapur by train, how much would it cost? 1,500. And if we are not willing to take that 1,500 rupees out, but you want to come back home, then in case the state government has to provide for everything, the logistics would become a nightmare, because then we would not be able to provide once they come back. The quarantine. What has been decided in the district level committee also is that the MLA is concerned, we will be providing the essentials, which means the food, everything that the quarantined citizens come, the ones that are quarantined at village level, the MLAs are going to provide all the food for that, as well as the essentials for that. So likewise, there is a saturation for the funds that are available. So if the individuals concerned are asked to provide a certain part of their expenses, I think it is not so wrong in doing that. For example, during such a time, one is general instructions. Everybody is treated the same. There are general instructions. Second is the humanitarian side. Now, we cannot, from the first point, start issuing certain directions saying that certain people will be exempted, certain people will be accommodated. That cannot be a directive from the government side. So, from my side, what I would like to ask our community outside is, like the first day when I had said, there is a certain limit to which a person can help. Now, within our community, like you have said, our people are in the hospitality sector maximum, most of them. And it is a very low paying job. I have my own nieces, my cousins, my nephews, they're also working outside. They've been calling me time and again, saying that they're being thrown out. I cannot, in isolation, send my nephew some extra rupees, because this is not something that is a family matter. There are certain general instructions. Now within that, within the place that our people are in, this is why this data that was asked for by the Tangkhul Nagalong, maybe about a month back, from all the villages, we had asked for data from all the villages as to how many of our people are staying in which place, from the cities. But I think till now, a lot of them have not yet given that data. In case they had submitted that data, we would have known which person is displaced, which person is still functioning well, which person is in the organized sector, which person is in the government. Then the community was going to reach out, asking that it is time we start helping each other. Just giving a very small example, supposing there are 50 from my village in Delhi, and 10 are in the organized sector and still doing well and working well. We were requesting the 10 to, help with about 20% of their salary in trying to augment the needs of those people who have been displaced. This was the reason why the community had asked for the data of all our citizens across the country. But we have still not yet provided that data. I understand your problem, saying that our people are in the lowest strata of economy and they have to be addressed. Now, once we get there, we will address it. But we need the data. Without that data, we cannot move ahead. Once we have the data, then we know that this person is displaced. Because each and every single person, the Tangkhul Katamnao Soklong, they are calling over phone. Personally. This I say again, personally. You can, communicate with the Tangkhul Nagalong after this, and you can ask them. I think they have already spoken to close to 18 to 19,000 individuals already, as of now. So, they know the situation and the condition of each person as of today. It is trying to reach out and help our people that we are asking for this information. Now, the general instructions that everybody is to pay for their respective fares, that will stand. But at the same time, if there are people who need among that, this is where the community comes in. That is why the community had asked for all the data and exactly what who is doing as of now.
Great. There will be an exodus once this travel restriction is lifted. There will be a lot of problem like economic or unemployment problem. So what can government do or help in this situation?
As it is, we are cash-starved economy, at least with regard to the hills of Manipur. Our people are unemployed, jobless, so this is exactly why so many of our youths have gone in search of greener pastures, in search of sustenance. And this, I say sustenance because they earn just about enough to make ends meet. The only way out is we are trying to make arrangements, and we have already contacted a lot of departments with regard to this, be it from the agriculture sector, be it from the horticulture sector, be it from the agriculture or allied sector, be it poultry, be it piggery. Once our youth come back, we know that some sort of employment has to be provided to all. Provision of employment should be on a sustainable basis. It cannot be a one-time affair where I give you an employment for 3 months and after that you are jobless. Our people have to understand that when they come back, some form or the other of employment, I am already in the process of executing it. It will happen. This I say again, it will happen. But when that happens, it is for them to ensure that it is sustained. For example, supposing we provide 100 chiclets worth about 10,000 to a person. The person, rears it for 3 months and he can sell it in 3 months' time. He cannot expect to come back to me again asking me to provide the chiclets. This sort of sustainability that has to be provided, that has to come about from our own people. This will be the biggest request that will come from our side, because we will provide them certain things when they come back, but they have to ensure that it is continued. We cannot keep providing to the same person. That is why earlier I had said, what will happen after the provision of this free PMGKY rice? Earlier NFSA 5 kilos, PMGKY 5 kilos, that is 10 kilos. Starting from July, it will go back to 5 kilos. What do the people do after that? This is why I kept insisting, I am not here to give freebies. I will never give freebies, and I have not given freebies till date. But the only thing that I am ensuring is the price. The price is curtailed, and we have ensured that the price has been curtailed because the district administration has provided at the cheapest possible prices for the community across the district. So now, when the people come back, this is an appeal to our people also. When you do come back, constituency-wise, I'm sure my other esteemed colleagues from the other 2 constituencies, they would have already formulated their working plan. And unless we give them something to do, they cannot come back and be a hindrance or an extra baggage of society. They have to come back, they have to work hard, and then try and ensure that at least the drain of our wealth as in like the intellectual drain of our wealth, which is now totally outside. I'm hoping that some of them come back this time and try and help build our own people, use our land, and try and use our own resources, not deforestation, but in different means and modes, whatever they have learned across the years, apply this in the right areas, and we are there. Like I'm saying, holistically and logistically also, we will definitely provide. But it's after the first step is taken by us. From then on, it is the responsibility of those incumbents that are coming back. Last piece of advice that I would like to give our people. In every society, there is a system. Our system says that it is the district administration that we have to come under. I would like to repeat again and again, let there be no duality, let there be no triplication. Only through one channel. The district administration is being run under the direct supervision of the state is being run by the center is being directed by the World Health Organization. So likewise, since whatever is being instructed through the district administration, I want our people, that is the citizens of Ukhrul district and Kamjong, to follow it to the end, right to the decimal point, because this is what will keep you safe, and this is what will ensure that our community stays strong, survives, and moves ahead. Because like it was mentioned earlier, the new normal is social distancing and using face masks, washing your hands, all these norms that have been put out. Unless we start doing that, then we cannot start our lives. You please do not expect to go back to your old normal. If you're expecting to go back to your old normal, then you are, like I say again, you are a liability to the entire community and you will pull us down with you. Let us not be selfish. Let us come above our own selfish ends and contribute towards the society. That's why follow each and every instruction that the district administration is saying from time to time. Thank you.
Can you tell us the current status of the hospital in terms of handling the pandemic?
Yes, as of now, we have arranged a 16-bedded isolation ward in District Hospital Ukhrul. 8 bedded for female patients and 8 bedded for male patients. This patient will be especially for those cases who came with positive travel history, positive contact history, and for patients with symptoms of COVID-19. We'll treat here and if they are suspicious of COVID-19, we'll collect the sample here and we'll send the sample to Jennings for confirmations of COVID-19. And as per the confirmation report, we'll take up necessary further treatment. We have been trained here for collections of sample and how we have to transport a sample. Since district hospital is not equipped with diagnostic machines for this test, we have to send the sample to Jennings for confirmatory tests.
What are the extra precautions Ukhrul Medical Department has taken so far?
We have been doing trainings of all the staffs since the first week of March. Training is an ongoing process. We have been training for all categories of staffs, like how to do doffing and donning of all the protective gears and all the do's and don'ts, and how to dispose of the biomedical waste of COVID-19 patients. We have also established a flu clinic in our hospital where we screen out all the cases coming with COVID-19 symptoms from other patients attending in the OPT. So through that, we can screen out the patients.
So what would be a major challenge once there is a travel restriction is lifted and people started coming back from outside?
The major challenge will be, accommodating all those outsiders coming to our district in huge numbers. If all of them are okay, if all of them are symptoms free after keeping them in the quarantine ward for 14 days, that's okay, that's fine. But if COVID positive patients also started coming in, then we'll have some problem, because the resources, the manpower which we have right now in the district hospital is only limited for 16 patients. So if the number of patients is less, we can handle it. But if the number is huge, we won't be able to manage the cases.
What will happen then?
We have to refer some of the patients to Imphal. Jennings and RIMS have been identified as a COVID dedicated hospital. However, a time also when this hospital is also overwhelmed by COVID patients. In that case, it will be very difficult to manage these cases. Right now, we have identified 10 quarantine centers in Ukhrul district, and out of that, 3 quarantine centers can be functional, can be activated any time. All those immigrants coming from other places will be quarantined in those centers for 14 days, and we will observe them in that quarantine centers during these 14 days for development of any COVID-19 symptoms. Ideally, and as per guidelines, it will be better if you can keep in a separate room. I mean, one person should have a separate attached bathroom and toilet. But due to the deficiency of such structures, such buildings, right now we have to keep them in a dormitory type of these things building, where all the people, I mean, immigrants are kept in one room. Say 10 persons will be kept in one room. But there will be, they will observe all the do's and don'ts. We have made social distancing also, like say the beds which we have kept should be 3 feet apart, and all the do's and don'ts of hand washing, everything would be taught there. So right now we don't have the required infrastructure to keep separately for each person, but we have maintained, we have made it sure that, like say, they would have to observe all the social distancing and others do's and don'ts of COVID-19. For upgradations and improvement of our isolation ward and other facilities like ICU, the government has recently, say a few weeks back, the government has sanctioned us rupees 10 lakhs. Without a sanctioned amount, we'll try to improve, we'll try to upgrade the existing isolation ward. Plus, we'll try to upgrade the existing ICU ward to deal with COVID-19 cases.